Hi, I'm Dr. Bill Wyatt, and I am a general dentist, and I've been doing orthodontics now for over 45 years. I'm trying to pass on some of the things that I picked up over this period of time. I'm a member of the American Orthodontic Society, and this is a society of general and pediatric dentists, and our main purpose is teaching general dentist and pediatric dentists orthodontics. We have a wonderful organization. We have a journal. We have our annual meetings. We have other meetings. We have a group of talented young men that teach orthodontics. Some of them aren't so young, I guess. uh, to any dentist really that's interested in learning orthodontics. And we do a good job. And if you can pass the boards of the American Orthodontic Society, you can doggone sure do orthodontics. And if you are doing orthodontics, we encourage you to join a good organization like this that has a lot of purposes that you'll need to know. Uh, that's my deal here, Dr. Bill White. This is a beautiful little Oriental lady who's, I think, quite young now and doesn't show much on the outside as far as the teeth are concerned to have the problem that she has. Uh, Very nice smile line, a beautiful face, uh, but she has a odd set of impacted teeth here on the right side of her mouth from the cuspids, and the two bicuspids are impacted. I'd never seen anything like this. She had her kinfolks were dentists, and they had checked this out and gone over it and decided they'd just send her over. They didn't really know what to do, and quite frankly, I wasn't exactly sure what to do either. And I'll show you some of the x-rays to start off with. But we went ahead and tried a conservative method of doing this. You can see the bicuspid up on that side slightly, not too much, but here's the bicuspid trying to come in right here. And then the first bicuspid is up in here, and the cuspid is up on top of these. I don't think I've ever seen anything quite like it. Now, let me show you some of the x-rays here in a minute. Looking in from this side, not any big problem. A little bit of crowding over here on this left side, and rotation. You have all kinds of little simple orthodontic things, no problem with that. I don't think that we didn't take any teeth out and it filled the mouth out, and she didn't look protrusive when we finished. She looked quite well. Anyway, the lower arch was not in that bad a shape. You see, it's lined up a little crowding down here at the bottom, not the anterior parts there, but not anything to speak of. Now, when you look at the x-ray, it's a different situation. When we first looked at this, we didn't think that we could actually get this cuspid tooth to come down into this area and then bring this one down, and this one came right down in here. It didn't look like we could do that, but I felt good to try. It but we thought for a while we were going to have to extract that tooth. And we thought if it didn't respond, we would come back and do that. Then have to put a implant or something in this area right here. And we later had to come back, if I remember correctly, and take her wisdom teeth out. I don't think she had room enough, but she may have. At this time, she's 13 and 2 months, so her likelihood of growing much is not too good. She probably grew a little bit more. Alright, so we went ahead and started without doing that. And we had I think there was maybe an old surgeon in the family, and they went in and attached this chain to the cuspid right here. And this was in September of '96. And we started tugging on this cuspid to come down. And as it came down, my recollection, it just brought these other teeth with it. It was a strange thing to me. So here's some pictures of it. We lined everything up and put our braces on, and we were straightening up and rotations and all this, and we had this headed in this direction. As we tugged on this tooth began to move, and the other tooth began to move. And then we pulled it on down like this. You can see we pulled on the arch wire, and these teeth kind of raised up in here. And then this comes on down further. We have to, of course, expand it and get the cuspid down in this area. The cuspid came on in this far, and we pushed back on it there with some, I don't think we used any headgear at all, and it kind of moved this second molar back, and then this one was back some, and we continued to go pull that on down and open that space up. And here we shoved the molars back some, and maybe the front teeth came forward also. So we're shooting this with an old Pyrex now, where we put this thing together, so you get a double image down in this area here. And just kind of ignore this. Here's your central, your lateral, and your cuspid, and your first and second bicuspid as we go back in it. So that's the central on one side, here's the central on the other side. Now, let's see if I have another x-ray here. Yeah, okay, it lines up better, and we'll have to come in and kind of torque this root over, bring this out, and close this up, and then these teeth will tend to contact here, and this will move over without doing anything to it, really. And that's a little later, but we have to see, she had let me go back here. The second molars on the upper, this one looks much better. This was still got a problem with it. And I may have ended up with this tooth still reared up. I should have banded it or something and bracketed it and kind of straighten it out and get this root going up in here. Looks like there's some problem in this upper area where this wisdom tooth was removed, but you could accept that with the problem that they had. Okay, here we are, the tugging of this to bring this cuspid in, kind of raise this arch wire up like that. Now there'll be no big problem bringing this down. We'll see what that does as we go along. But it was amazing to me that as the cuspid came down, it kind of took the two bicuspids with it. So we're still pulling the cuspid down up in this area somewhere. And we keep pulling it toward this lateral. And this is 12 of 96. I forget what month. Well, I think it was September or something like that. 96. So we've been working on the case all that long. Now, as we get down here, you're going to have to expand this place here, which we did. And the lower teeth we've lined up pretty good. No big problem there. Now we came back and we're still pulling on that to try to get that down. Now the cuspid is in place and we'll continue to, I'm sure, wear vertical elastics in here. And that's pulling it down with these vertical elastics. Now we pull from the back, you see, with a long elastic underneath and come up here so that the person can open and close their mouth, and this elastic will straighten down. Now then it's kind of moves over this area. A lot of times they'll cut themselves in two and they'll have to put elastics on different times during the day just to keep a fresh pressure on it as it comes on down into the mouth. Now this elastic also pulls the back teeth toward the front, and then here it starts pulling them up. But this one didn't move very much. We've got a pretty, fairly solid archware there. Looks like about a 016 or maybe an 018 round stainless steel in there. Alright, the cuspid starts in, and I jumped that pretty quick. Now we've got it wide enough, bring the cuspid in. We'll have to get into a rectangular wire now to bring these roots in like that. So there's the upper cuspid. Have a little cuspid eminence there. And this is 7 of 97, so this has been in there just slightly over a year. And we've got it lined up pretty good right now. Well, the cuspid still needs a little space to come in. We need to torque the root in. And we put a little cuspid eminence in the arch wire because it's such a thick tooth right in here. But as we bring it into the center, we won't need as much of that movement there. Now the bottom's lined up good. Okay, cuspid's looking a lot nicer now. It's still out on the buckle some. Well, it's 90. It is now January of 98, so it started, I think, in September of 96. So here's what's happened. The teeth have come down and filled in that gap, and we had to bring this tooth right here back. Well, it's back further than that to get it into a good class 1 relation. So hopefully did all that. It looks pretty good as far as the class 2 correction there. And that's 98. Right here, 96. And there it is in, I assume, 98. side's good. And there's all three of those teeth in line. So this is 1098 right there. So a little over, well, let's see, it was 6, I don't remember, something of 96 anyway. But that's turned out quite good. Here's the lower arch. And it's lined up good. Okay, that's one of them. We'll have another case come up here, another deal. This young man looks pretty rough, but he's an extremely nice fella, and he works on a construction job, and this is taken just a little after we started, but his facial structure is really quite good, even though his teeth are in terrible shape. So here we are, and this is 1983, and we've got these upper anterior teeth that's all bunched up together up here, and I think there's some deciduous teeth, the impacted teeth. I have to look at the x-rays here to tell you exactly. Real nice guy though, when we went through this orthodontic treatment with him. He's not far off of class 1. In other words, this just needs to go down here and here. This will come down in there. This tooth will drop back in this area. So anyway, we're not far from class 1 on the right side of the mouth. On the left side, a very similar thing. It's a little further toward class 2, but not a big deal in there. Now there's impacted upper teeth, and deciduous teeth. We'll have to go to their x-rays to see that, and that's filled in. So here we are starting the orthodontics. This was way back there in 90, this is 84. And we've got the flexible wire, we've got expansion in the back of it, you see it, the little flexible wire. Now this was before we really learned how to hook on this spring system that we showed you to start with. Here we're just expanding the arch all the way around. And that's some deciduous teeth we had removed. We'll run through this pretty fast. There's a lot of stuff in here. This impacted tooth was up in the roof of his mouth right here. So that's the cuspid that we're going to try to bring into this gap right here. And we didn't really know as much about impactions then until we figured out this spring system that we'll have already shown you in some of the cases. And we'll show you this again. This we were able to slide that right in the palate, and on the bottom we're going to expand those teeth a lot. So this is we'll run through that. Now we were just tying elastic string, I think, to these teeth back in this time, pulling this over, and then you got a fairly flimsy wire. Looks like about an 016 stainless steel in there that we're expanding here and also here, so making more room back in that area. Okay, it's come along some. Our arch form is really off here, and the arch form on the bottom is off also. That will level out though after a while. Now we'll continue to go, and we're getting into heavier wires. Looks like we're in a rectangular wire on the bottom arch, and up on the top we're still in a round arch wire. So this is coming on. This cuspid tooth now is moved from down here somewhere till it's up to this part. So we'll get it up here and get this wire out further and just continue to bring it up. We don't have our good system yet worked out, but we'll get that later. Alright, the arch form on the bottom is getting better. I mean, we've got a pretty heavy arch wire in here. We've got a little cuspid eminence, you see, to keep these incisal edges lined up across here. And he's got a pretty bad chip or something in this tooth right in this area. Oh, getting closer and closer. That's the other. I'm going to shoot it on one side and the mirror turns back over on the other. So now the cuspid tooth is out there and we're opening up space to get the other cuspid. And so this whole center line is going to have to move over in that direction. This takes a long time on this case. Now the lower's lined up pretty good now as everything's coming along. The uppers where we've got this one in place and we're working on getting this one down in place. That's pulling that back to your class 1 and we're trying to get this one down in place, get the roots of the laterals out of the way. So you can see the center of the palate is kind of headed off like that. And gradually this thing will center. But so the whole bone in the palate moves around when you're doing something like this. Okay, that cuspid we get in line. Now we've advanced. This is 19. Looks like 85. Now we put a step-up arch wire in here where you can bend these legs out like this and make these teeth move apart, forcing it in there. And you can actually kind of direct the way the roots go on these teeth with this type of arch wire. So it's coming along. Now we're down to this point. Now we're getting pretty close. And it looks like we've got the cuspid okay in place. We have just a false cuspid stuck on the arch wire, you can see. It looks pretty normal. And here's what he had. There's no tooth in this area right here, so I remember this. I recommended a bridge, and we were going to think about taking these wisdom teeth out. In this case, now we've moved a lot of teeth together and things, and slide things forward. It's possible to take this case like this and maybe shape these other teeth up to look like a cuspid and have a lateral and cuspid and bring this molar further forward in here and utilize this wisdom tooth to come down there. So today we might do that rather than take that out and leave a space there to bridge or put an implant in. Now back in '83 there wasn't much implant doings. Alright, we got the tooth in place and we're just going to open up the gap and keep the gap for the young man. This is class 1 on that side now. We're opening that up and he later had a bridge put in that area. So if we'd have been thinking like we do today, I'm pretty sure I would have taken that first bicuspid and pushed it up here and shaped it up like a cuspid. Used the second bi and then had the molar fill in where we had moved the second bi forward. Today that would be my decision to do that, but back then we didn't really understand that as good as I would like to. But now we've got the form and then it's got an artificial tooth in there, which we'll leave on the retainer too. So now here's his retainer with the artificial tooth on the retainer, and he'll wear that until he gets a bridge. And that's a lower removable kind of spring retainer from 3 to 3, which I do not like, and we recommend bonding this on later. We started just bonding that all together. That's not perfect, but it's looking pretty good. This is 1990 after we had taken him out of this sometime, and went in and put a bridge over on that side. I would much rather you take that bicuspid now, push it up there, and we would have kept that wisdom tooth. So our diagnostic have changed over the period of time. Now he's a much nicer looking guy now. Got a nice smile. And because that's will be the end of this video here. Let's turn back to the other one. So hope that you can use what we've done there. The second case has been done a long time ago. We have some more that we will do later on, but we will go ahead and stop this for now.